Hello and welcome to Seven Sentinels. This is Grand Master Class and I am Peter Simon with you. Today we are conducting a session for reading. The topic is pneumonia and the section is part A. 20 questions. We are going to have it non-stop. Twenty questions. We'll take a little bit of time and try to understand carefully how to analyze each and every question. That is our point for today. Yeah. Now this is the first text A. It is text A. Assessment, admission, and discharge. So the subtitle, the title is pneumonia, and the subtitle for text A is pneumonia, assessment, admission, and discharge. That means bothered about pneumonia cases only. Yeah. Next, second one. Information to give patients. Community acquired pneumonia. Community acquired pneumonia. So, this is regarding awareness. Awareness to the patients. Awareness to the patients. That means already diagnosed. Already diagnosed. Okay. Already these two candidates are diagnosed. Fine. So that means they are undergoing treatment. That means they are in the progress to recovery. Okay, recovery. First week, fever resolved. Second week, third week, fourth week, sixth week, back to normal means recovery, total recovery. So like that. So these are the recovery stages. Improvement stages. Improvement, recovering. So the word you can take is recovery. Next, C. C is related to thoracentesis procedure. Thoracentesis procedure. And this is a procedure here. This is a procedure. Yeah. This is a procedure. The steps involved in this procedure. The steps involved in this procedure. Right. Next one. So this is procedure. Next, last one. Complication. Complication. Comment and treatment. What is the complication? Bacteremia is one complication. ARDS, acute respiratory distress, is another complication. Then pleural effusion is one complication. So these are all complications. Complications, comment and treatment. Complication. These are the definition, explanation of what is this bacteremia, explanation of plural. So this about complication. Now we can consider, yeah, we can now consider these four, okay, these four titles like this. Yeah, right. Now the question here is, now you can notice here, in which text can you find information about something? In which text can you find information about the information about something? Text A is related to admissions. Text B is related to recovery. Text C is related to procedure. Text D is related to complications. So you have to study the question and you have to identify in which text, A or B or C or D, or you can say admission related or recovery related or procedure related or complications related information. You have to identify and you have to tell. So I hope you understood how we got these four words: admission, recovery, procedure, complications. Once again, so admission came from here: admission, assessment, admission, and discharge. If you assess, then admission. After admission, discharge. So admission is the central one. Admission. And here, this is recovery, recovering. Awareness of what to expect when recovering. So recovery, improvement. Okay? Right. So this is recovery. Then this is procedure from here. Procedure from here. Then complications from here, because all these are complications. Complications, remember. So this is how we got the four terms: A for admission, B for recovery, C for procedure, D for complications. Then next, we'll go to the questions. These are the 7 questions. Just rush fast. Find out. Just read on the top. No need to go into depth. Just read like that one. The typical recovery timeline for pneumonia. The typical recovery timeline for pneumonia. Now let us see the definitions of medical terms related to pneumonia. The second question, definitions of medical terms related to pneumonia. Medical terms means extraordinary names. That's why definition is given. If they are simple names, no need definition. That means they are serious things. They are very, very important things. So that's why you have to focus on these areas. Okay. Next, third one, the equipment carried out, the equipment required to carry out a specific procedure. So the key word here is procedure. In the first one, it is recovery. Second one, it is definitions. Third one is procedure. And the fourth one, patient guidance regarding medication side effects. Patient guidance regarding medication side effects. So there may be side effects. Why? Because you are taking medication. That means you are going taking treatment. That means you are in the recovery mode. So medication for recovery. If you take medication, that means recovery is there, but there are side effects also. That's The question is related to recovery, like that we can think. How to decide whether a patient should be hospitalized? Admission. So this is hospitalized means admission means before admission. So if you diagnose, then you can admit him. If he is not diagnosed, then you will not admit him. So hospitalization is related to admission. Admission to the hospital is hospitalized, like that. Next one, sixth. The underlying cause of some conditions associated with pneumonia. Conditions. Conditions. What are the reasons for this? Conditions associated with pneumonia, special conditions. So, special conditions means serious. Ordinary conditions means normal, general. So, you have to understand like that. The next one, the type of patient for whom the standard evaluation will need adapting. Standard evaluation. Evaluation means assessment. Assessment before admission, maybe. So, adapting for special, what type of patient? That's what he's telling. Next questions 8 to 14. So go through the questions 8 to 10. So removing too much fluid during thoracentesis. Thoracentesis is a procedure. Increases the risk of low blood pressure. So you should understand from where information is taken. So A or B or C or D. So thoracentesis procedure. So it will be from procedure information. Right, procedure related information. Next question number 9. Most patients can expect to make a full recovery. The key word is recovery. That means this is recovery related information. Recovery related information. That means you will find the information in text B. You'll find the information in text B. That's what it is. Next, in order to reduce the risk of pneumothorax, in order to reduce the risk of pneumothorax, the patient should dash during withdrawal of the catheter. In order to reduce the risk of pneumothorax, the patient should dash during withdrawal of the catheter. So, withdrawal of the catheter, the risk. So, to reduce the risk of a pneumothorax, so you have to find where pneumothorax is. So, then you'll get the information there. Next, 11 to 14, go through them once. So, 11. Choosing an insertion point above the dash. Choosing an insertion point above the dash during thoracentesis reduces the chance of injury to the abdomen. Okay. Choosing the insertion point above the dash during thoracentesis. That means this is procedure related information. This is procedure related information. Remember that. Yeah. So you will find in text B. Sorry, it's text C, procedure. Next 12. Question number 12. A patient may still feel tired dash months after pneumonia. So now he got pneumonia, and after getting pneumonia, he is being treated, but he will be still feeling tired dash months after having pneumonia. So you should understand in what it is he is recovering. So still that feeling of tiredness is there. So you have to see most probably in the recovery information related to recovery. Next one, number 13. Patients who cannot dash independently may be required to remain in the hospital. So that means this is in the admission details. Most probably this will be in the admission department. So admissions. So assessment, admission, and discharge. So you will not discharge this person because he cannot do something independently. So it will be in text A, most probably. So you have to go to text A to find this information. Then, patients whose blood oxygen levels are lower than dash may be at a greater risk of dying. Greater risk of dying. So that means you cannot discharge him home. So that means it will be also in the admission department only. Information related to admission. That means his blood oxygen levels are lower than some degree, some percentage. So then there will be greater risk of dying. So he is already admitted. He has pneumonia and is admitted, is undergoing treatment. So, but he is to be not to be discharged. So you will find this information mostly in A. Now go through the question 15 to 20. We are guessing which information will be where. So this is very important. In the beginning, you have to go through this. So how many mLs of fluid should be removed from the lung for investigation of the patient's condition? So you are removing how many mLs? Okay. Yeah. How many mLs? So this information mostly will be in text C. Mostly this information will be in text C. So procedure. So you are removing a fluid. Okay. Fluid. So for investigation, lung for investigation, remove from the lung. So, right. Next, when performing a thoracentesis, so how many mLs of fluid? That means milliliters of fluid. That means it is a number. So this is very easy to identify. Wherever there is a number, you have to identify that number and that you can check. Okay, there will be very few numbers, so it is easy to identify. Numbers are very easy to identify. Next one, when performing a thoracentesis, so this is from procedure. Which part of the rib should be avoided whilst inserting the needle? Rib. So go to thoracentesis procedure. There you find out rib and which part should be avoided, find out. So it is from the procedure part. Next one. Which treatment may be necessary for patients with ARDS? Which treatment may be necessary for patients with ARDS? So ARDS is a special medical condition. So it is a complication. So you have to go to the last text D, complications. There you will find a treatment for this one. Okay. Then you have to write which treatment you have to write. The next one, 18th one. What should be used to protect the insertion site following a thoracentesis? So this is procedure. So thoracentesis procedure. So what should be used to protect the insertion site following a thoracentesis? After thoracentesis, what should you use to seal the insertion site, close the insertion site, protect from infection? Okay. So it will be in procedure. C. What is the risk level of a patient with a CURB 65, CURB 65 score of 2? There will be levels, score of 1, 2, 3, 4, 5. 5 scores will be there normally. So 5 scores. First one is low risk. Second one is maybe moderate risk. Third one, fourth one, fifth one will be high, extremely high, very extremely high, like that one. So 5 levels will be there normally. So what is the risk level? You can say is it mild or moderate or intense or serious or dangerous or extreme or highly risk. What is the name given to that one? You have to see. So very low, like that one, or what is the name given to that level of risk? So you have to see this one in risk. Okay. So you can go to the admissions. Okay. Level of risk. You can go to admissions. Then how is medication for bacteremia usually administered? Bacteremia is a medical condition associated with pneumonia. So bacteremia is a serious medical condition, that is a complication. So you have to go to D, that is complications. So I hope you understand what I am telling. If you understood so far, just to give yes, sir, understood. I am typing the word understood and giving a question mark. Can you please respond yes or no? Amrut, Ansi, Dorcas, Joyce, Silpa. Very good. So if you understood, just to type the letter word yes or no. Any one word, so that I can continue to the question part. This is called guesswork. Yeah. So three people have given the response. Very good. Yeah. Now we'll go to the question number 1. Now, question number 1. Right. Now here, floating meeting controls. Okay. Now we are going to deal with these things. Be with me patiently because you are going to learn the concepts. So this is the first one. So this is text A. Text A. You can check there or you can check here afterwards. No problem. So yeah. So next one is text B. This is text B. Yeah. This is text B. So you can go through it afterwards. This is text C. And this is text D, complications. Yeah. Now we have the 4. Yes. Now this is the division, the labeling. This is the labeling, the question, which all the 20 questions you have to identify like this. It will be then easy for you. If you identify the questions like this, where the information comes from, it will be easy for you. A is for admissions. Yeah. So the title and subtitles. So pneumonia title, subtitles admission, recovery, procedure. Yeah. Next. Okay. Now the first question is here. Hide floating meeting controls. Yes. The first question is here. The typical recovery timeline for pneumonia. Okay. So this is the question. So fireball 1. This is the question. Come on, guess. What do you think is the answer? All of you, write in the chat box. Fireball 1. Write down your response. A, B, C, D. Where do you think will be the answer? Guess. Afterwards, we'll confirm. The typical recovery timeline 1 month, 2 months, 3 months, 4 months to 6 months, like for pneumonia. The typical recovery timeline for pneumonia. Recovery. What do you think is the answer? A, B, C, D. Where will you find the answer? Yeah. Write down your answer, please. Can you guess? What might be the answer? A, B, C, D. Which is the answer? Write your answer. Are you all busy or something or what? Nancy, Dorcas, Joyce, Silpa, are you doing work or busy with something else? Okay, just write A, B, C, D. Check, guess, and write. Yeah, right. So this is regarding recovery. So recovery directly goes with recovery. So most probably it is with B. Okay, at least somebody responded. Thank you for responding, Silpa. So now we'll check our answer. Okay. So create poll, fireball 1, A, B, C, and D. Okay. So this is logical reasoning approach. Logical reasoning approach. You reason, then you'll get the answer. So let us check the answer is something. So Silpa said B. So let me check whether the answer is correct or not. B. So B is here. Check. Full recovery, right? Full recovery. The typical recovery timeline for pneumonia. The typical recovery timeline for pneumonia. So recovery timeline. Timeline is here. 1 week, say 4 weeks, 6 weeks, 3 months, 6 months. 6 months, most people will feel back to normal. So recovery timeline. First week, what happens? 4 weeks, what happens? 3 months, what happens? Okay, 6 weeks, what happens? All these things are there. So it is in text B. So the answer is so now check what is the answer. You can check copy post link. So this is from the Telegram. You can click there and you will come here. You will click on the answer and it will tell you whether it is right or wrong. A, B, C, D. So click here. Somebody has already clicked here. Okay. So right. If you click A, that means it may be right or wrong. You will know that very clearly there. So right. Then next one. So second question. Yeah, the answer is right. Recovery timeline. Recovery is the correct answer. Recovery timeline is in recovery paragraph or text. Then next, second question. This is the second question. Go through this question. So this is fireball 2. Fireball 2. Yeah. The definitions of medical terms related to pneumonia. The definitions of medical terms related to pneumonia. So what do you think is here? Which text is this? A, B, C, or D? Give your answer. A, B, C, D. Which is your answer, you think? Fireball 2. Fireball 2. Give your answer. The definitions of medical terms related to pneumonia. There will be some complicated words and conditions. Okay. So maybe related to that. So check which is your answer. So if you can do this one, afterwards you can find the answers also very easily. A, B, C, and D. Logical reasoning approach. So, anybody has given the answer? Okay. Yeah. So the answer, you can check your answer. Copy, post a link. Yeah, majority of you are given D. So you can go there, the link, click on the link, you'll go to Telegram channel and you can check the answer here. Okay. So now let us confirm the answer. So let us go to D, whether there are definitions of medical terms or not. Let us check. Yeah. So complication, bacteremia. Bacteremia definition is presence of multiplication of bacteria in the bloodstream. That is the definition of what is bacteremia. Pleural effusion. Pleural effusion means the definition is accumulation of fluid in pleura. So that is the definition. Pleurisy definition, inflammation of pleura. So try to understand. Okay. So these are the definitions. All these are definitions. This is the term, the condition, name of the condition, and this is the definition. So it will be very easy like this. The next one, Simiyat Abdul Rahim, welcome. Yeah. So next, third question. Third question. Third question. Fireball 3. The equipment required to carry out the equipment required to carry out fireball 3, a specific procedure. The equipment required to carry out a specific procedure. Okay. The equipment required to carry out a specific procedure. Yeah. What do you think? Where you will find a procedure? The equipment required to carry out a specific procedure. Procedure is procedure, direct answer. So most probably C is the answer. So you check what you think according to your answer. So just give me that. So we'll go and check here. Check in C. Equipment used. What is the equipment used? A syringe. Here it is a syringe for aspiration. A syringe. Okay. Over the needle, 18 gauge over the needle catheter, syringe. All these are okay instruments. All these are instruments. Needle, 25 gauge needle, 18 gauge needle, syringe. So catheter. All these are instruments in the procedure. So the answer C is correct. Yeah. So bear with me. We'll do all the questions, 20 questions. Relax and cool so that you will learn because many people fail in the exam. So we should not take any risk. Okay, we'll learn it perfectly well. Slow motion, no problem. Logical reasoning approach. So C is our answer. Right. Next one. So question number 4. Question number 4. Yeah, this is question number 4. Yes. Fireball 4. Yeah. Copy post link. Yeah, you can check your answer here for question number 3. Say see whether C is correct or not. You can check there. Okay, I have sent the link for question number. So go and click on the link and check whether your answer is correct or not. Because I did not tell you what is correct, what is wrong. Okay. Now fourth question. Yeah, fourth question. Patient guidance regarding medication side effects. Patient's guidance regarding medication side effects. Now, where do you think this information will be? Where do you think this information will be? Patient guidance regarding medication side effects. So, will it be in A, admission? Okay. Then B, recovery. C, procedure. Okay. Create poll. A, B, C, D. Yeah, patient's guidance. Logical reasoning approach. Logical reasoning approach. So, what was our answer? I told you. You can check your answer. Okay, write your answer. So, this is the link. Copy post link. So, now Fireball 4. Fireball 4. Yeah. So, check your answer. What do you think is the answer here? So, patient guidance regarding medication side effects. So, is it related to admission? Before admission, diagnosis like, or recovery? So, he's recovering and he's taking medication and he has some side effects like that, or procedure, okay, or complications. What do you think is the answer? Check there. Simiat Abdul Rahim, long time, no see. Okay, right, very good. Faster to react. What about the others? Give your answer and go and check the answer if it is right or not. Next, question number 5. Question number 5. Now, this is Fireball 5. Okay. How to decide whether a patient should be hospitalized? How to decide? Fireball 5. Oh, yeah. How to decide whether a patient should be hospitalized? So when you diagnose or when you do the assessment, then you will know that the patient has this pneumonia, then you will hospitalize. So will you find this information in admission stage or recovery stage, after admission or procedure stage, or complications. So where do you think? A or B or C or D? So find out the answer for question number 5. Where do you think the answer will be? A, B, C, and D. Okay. Where will you think the answer will be? So logical reasoning approach. Come on, write down A, B, C, D. Any answer? So you have written A. Okay. So good. So this is the link for Fireball 5. Then next Fireball 6. Next is Fireball 6. Yeah. So 5 over Fireball 6. The underlying cause of some conditions, not general conditions, the underlying cause of some conditions associated with pneumonia. What is the reason? Reason means explanation. Okay. So the underlying cause of some conditions. Okay, the underlying cause of some conditions associated with pneumonia. So where will you find this information? Will you find it in A, that is admission stage, B, that is recovery stage, C, procedure stage, or D, complications stage? So sixth one, what do you think? Where do you think will you find the answer? Information regarding this. So write down. Right. So you can also check copy post link. You can check the answer here. So yeah, Fireball 6. Check the answer here. Check the answer here. So go and check the answer there. I have provided the link there. Next we'll go to question number 7. Question number 7. Yeah. Fireball 7. Yeah. So where will you have this information? The type of patient for whom the standard evaluation will need adapting, means adjustment. Okay. For some peculiar cases, which patient is that? Will you find this information in text A, that is admission, or text B, that is in recovery, or text C, that is in the procedure, or text D, that is complications? So apply the technique, logical reasoning approach, logic. So that is the only way how you can understand this question. So this is 7th question. Try to analyze the question and tell me which is the answer. So Fireball 07. Yeah. The link is here now. The answer link is there. So 7 questions. Out of 7 questions, how many marks did you get? How many marks did you get out of 7? You can tell me. Yeah. Count your correct marks or not. How many marks you got and let me know. Now, so provide your feedback. Did you understand or not? So, did you understand clearly or no? Did you face any difficulty? So that we can go to the next set, that is round B. Yeah, round B. Fill in the blanks. We'll go. Just give your feedback. One line feedback. Is it helping you or not? Yeah. So Abdul Rahim, Simi has got 5 out of 5 because you are late now. Otherwise, you'll got the other two also. Yeah, Regina, very good. Thank you. So what about the others? Give your feedback, please. How did you like this session? Was it beneficial for you or not? Regina got 4. Silpa got 5. Very good. Yeah. Give your one sentence feedback, please, so that I can understand that you are going in the right direction and you are happy with the session. Like, yes, please. One more minute. Give your feedback. So we are going to round 2. Yes. So round 2. Round 2 is fill in the blanks. Round 2 is fill in the blanks. For this test, normally there will be short answer questions first. Round 2. Right. So fireball number 8. Yes. Fireball number 8. Now go through this question and try to understand from where this information will come. Is it in text A or text B or text C or text D? You have to identify. Text A, text B, text C, text D, you have to identify. Yeah. We are going to have free sessions for the next 3 days. So those who are interested, you can message me personally to my number where I have posted this. I'll give you my number afterwards. So you will get the link every day. So removing too much fluid during thoracentesis increases the risk of low blood pressure or dash. Where will you find this information? Is it in admission, or is it in recovery, or is it in procedure, or is it in complications? So you have to understand that one now. So floral, fireball, fireball 08. So fireball 08. Where will you find this information? A, B, C, or D? Afterwards, you'll go find the information. There are many ways how people get mark wrong. So I will help you. Don't rush. So Govind Verma says C. Regina says C. Procedure. Okay. Abdurrahim Simiyat says C. Okay, we'll go to C now and check whether it is right or not. So how we'll go there? We'll go there. 1 second. Okay. So the equipment required to carry out a specific procedure. So not this one, eighth question, right? Yeah, this one. I'm taking this information and pasting it on C. So C. Okay. So that is the question now. This is C. I'm going to explain this one now. Yeah. Now you check it out. Removing too much fluid during thoracentesis. Thoracentesis procedure increases the risk of low blood pressure or dash. Low blood pressure means hypotension. Low blood pressure means hypotension. Okay. Removing too much fluid. Removing too much fluid. Too much fluid. Larger amount. Larger amount. Larger amount. Okay. So this is it. Large amount. Then what will happen? Should be limited to 1500 ml. That is large amount. Maximum limit. To avoid the risk of pleural edema or hypotension. So hypotension already given in the form of low blood pressure, synonyms or paraphrasal. So the remaining thing is pleural edema. So pleural edema is the answer. This is how you have to identify. Somebody has written the answer pleural edema, but Govind Verma, you cannot write capital P in the middle of a sentence, the fill in the blank. So you should write small letter. If you write capital letter, it will be mistake. So careful. Right. So pleural edema. The answer is in text C. The answer is in text C. Okay. So same like that. Same like 1 to 7 questions. Here also you should find out like that. So create poll. So A, admissions. B, recovery. C, procedure. D, complications. So you will find the information in C. Right. This is logical reasoning approach. Yeah. So this is the answer link. Okay. Yeah, this is the answer link. This is the answer link. So now you have to find out what is the answer. Low blood pressure means hypotension. Okay. So you'll find in C there. Then you have to find out what is the answer. So answer you can write in the comment section. Okay. Right. We are just trying to find out 1 to 7 questions. That is the difficult part. If you find like that, then the remaining answer, it will be easy for you to understand. Next one. So question number 9. Yeah. Question number 9. Most patients can expect to make a full recovery from pneumonia within dash months. So, question number 9. So, this is Fireball 9. Fireball 9. So, where will you get this information from? So, you have to analyze the question. Most patients can expect to make a full recovery from pneumonia within dash. Okay. So, Fireball 9. So, Fireball 9. So, where will you find this information? Is it in admissions A or recovery B or procedure C or complications D? So, where will you find this information? Where will you find this information? This is about question Fireball 9. That is ninth question. Yeah. This will be, okay. Tell me which section you will get this information. Okay. And then you can check the answer. Yeah. Many people are responding. Very good. Okay. Yeah. Regina Ofoso. Don't send direct message to me. Send the message in the group, please. Change it to everyone. So, this is the link. Check. Go check your answer whether it is right or not. So, question number 9. So, now we'll go to, many of you said B. So, we'll go to B and find out. B is here. So, find out full recovery. Okay, now you can write the answers in the chat box. Full recovery. Most people will feel back to normal. Normal means complete recovery. Not even little bit of problem. Full recovery. Back to normal. Normal means zero problem. So, full recovery. So, how many months? What is the answer? Regina Ofoso, you have done 3 mistakes. In one answer, you have written 3 mistakes. First one is, if you see the question, months is already written. Months is already written. You need to write only the number. Why did you write month? So you lost the mark actually. Regina Ofoso. Hello, Regina. Do you understand? Yeah. I hope you understand. So, within 6 months, months already there, so no need to write months. And second thing,
Yes, sir.
yeah, 6 and month, you should not write a space. You put a space there. No space. You wrote a 6 month. You wrote 6 month. Your answer, you have written 6 month. But 6 months, months is already there, so you need not write. That is number one. Mistake number one. You need not write months, but you wrote months. So if you put in the blank 6 months, so it is wrong. Why are you repeating the word? That's the problem. Number one. Number two mistake. 6 and months, there should be space in between. You wrote without any space. That is the second mistake. That is the second mistake. And third mistake is you wrote 6 month, no S. That's again a mistake. So three mistakes in one answer. So be very careful, Regina. Is that clear?
Yes, sir.
Are you angry with me? Simon sir told me three mistakes.
No.
Huh?
No.
If you are angry with me, I'm not going to lose anything, right? Correct?
No.
Yeah. I hope you enjoy my lesson. That's why you are happy and laughing. Okay?
Yeah, I enjoyed it very well.
Right. So we are going to the next question. So see, done. Regina has committed three mistakes. So nobody should do like this. So because I told her now, she will not do such mistakes in the future. Next question. Question number 10. Question number 10. Question number 10. In order in order to reduce the risk of a pneumothorax, pneumothorax, pneumothorax. So where will you find this information? You have to think. The patient should dash during withdrawal of the catheter. Withdrawal of the catheter. So is it in admissions, recovery, procedure, or complications? That you have to check. So question number 10. So fireball 10. Fireball 10. Okay. So, in order to reduce the risk of a pneumothorax, the patient should dash during withdrawal of the catheter. So, now you have to analyze this question. So, where will you find this information? Fireball 10. Okay. Now, let us decide where will we find this information. A, that is admission. B, that is recovery. C, that is procedure. D, that is complications. Where do you think the information will be in which text? Logical, reasoning. I am taking more time now, but in the exam it will be easy for you. Okay, logical reasoning approach. So, where will you find this information? Okay, fireball 10. Okay, fireball 10. Where will you find this information? So, the patient should do something. So, you will ask the patient to do something. So, what will he do during the withdrawal of the catheter? Okay. So, where will you go? What is the information you have given? C, C, C. Very good. Okay, let me take you to C now. Let me take you to C now. C. So, it is pneumothorax. Number 9. Point number 9. Pneumothorax is a big word. So, size of the word. So, it is in point number 9. So, pneumothorax occurring. Pneumothorax occurring. So, in the point number 9, what should the patient do? So, you are asking the patient to do something. What is that? So, you will ask the patient to hum while the catheter is removed. The catheter is removed. Hum while or whilst the catheter is removed. Now, many people will write the word whilst also. You should not write the word whilst because whilst means while. While means during. During is already written. So, just one word hum is enough. Just one word hum is enough. Don't write more than that. During is already there. So, don't write a whilst. Okay. During means while or whilst. During, while, whilst, synonyms. Same words will not be given. Words will be changed. Withdrawal, removal of the catheter. So patient should hum, or you will ask the patient to hum. So like that. So be careful when you are selecting the words. Next, question number 11. Fireball 11. Choosing an insertion point above the dash during thoracentesis reduces the chance of injury to the abdomen. So choosing an insertion point above the dash during thoracentesis reduces the chance of injury. So be careful regarding above and below here. Okay? Above and below. So choosing an insertion point above the dash during thoracentesis reduces the chances of injury to the abdomen. Okay. Now, fireball 11. Yeah. Copy link. Okay, the previous question. Check whether your answer is correct or not. A, B, C, D. You said C. Check whether it is correct or not. Right. Next one, fireball 11. Yeah. Where will you go? A, B, C, D. Where will you go? Fireball 11. Question number 11. Yeah. Do you find this information in A or B or C or D? If you know, then you can go there directly instead of wasting your time and click on the answer immediately and come out. So, check it out. Logical reasoning approach. Logical reasoning approach. 11th one. Which text you will find? Check it out. So many of you wrote C. Okay. Then there you will go and find the answer. Okay. So confirm if C is right or not. Confirm. Click here A, B, C, D. If C is right or not. Then you can write the answer in the comment section. Right. So now let us go to C. Choosing an insertion point above the dash, above, below, during thoracentesis reduce the chance. If it is below, increases the chance. Below, above, reduces the chance. So let's go to C. Yeah. So there you see. 11th one. So, check it out. So, point number 3, insertion point. Insertion point, point number 3. Point number 3. Somebody has written effusion. Okay. So, okay, check there. So, above which body part? Below, above. Below should be avoided, means above should be used. So, because below means avoided due to risk of intra-abdominal injury. Below means risk. So, above means, okay, he gave here below. Below the ninth rib should be avoided, means above the ninth rib is useful, beneficial to avoid risk. Okay, right. So inserted above the ninth rib, so no risk. Below means risk. Insertion below the ninth rib should be avoided due to risk. So above means safe. Above means safe. So what is the answer here? Ninth rib. Ninth rib. Below the ninth rib should be avoided. So above the ninth rib is better. Choosing an insertion point above the ninth rib during thoracentesis reduces the chances of injury. Below means increases the chances of injury. Risk is more. So that's correct only. Be very careful. The answer will be twisted. So next, 12th question. 12th question. A patient may still feel tired dash months after having pneumonia. Okay. Months means timeline. Recovery, maybe. A patient may still feel tired dash months after having pneumonia, already diagnosed. So now he is getting treatment. So still feel tired dash months after having pneumonia. So you have to understand this one now. So A, B, C, D, fireball 12. Yeah, fireball 12. So you have to tell me A, B, C, D. Fireball 12. A, B, C, D. And next. So will you find this information in admissions, or B, recovery, or C, procedure, or D, complications? Yeah. So majority of you have given B. Okay, one has given B. Okay. Now let us go to B and check. So that is the link to check your answer whether B is right or not. Then we'll go to B. Text B. Yeah. Tired. What is the meaning for the word tired? Tired means fatigue. Tired means fatigue. So fatigue may still be present here. Fatigue. So 3 months. So what is the answer? Write down the answer. 3 is right. Now Govind Verma, you have written right nicely. Go. 3, not 3 months. You cannot write 3 months because months is already written. Months is already written. So next, fireball 13. Yeah. Yeah, fireball 13. Patients who cannot dash independently may be required to remain in the hospital. That means they will not be discharged. So 13. Fireball 13. Yeah. Patients who cannot dash independently. Okay. Is it in admission A, recovery B, procedure C, complications D? Yeah. So where will you find this information? Okay. 13. So you have DA. Yeah. Check it now. I'm going to give you the link for question number 13. Copy, post a link. Yeah, here is the link. Yeah. So 13th. So you go there to A and check and check and check. Yeah, 13. Finished. So you have to go to A and check the answer here. A. So here you can see the question there. Okay, who cannot means inability. Independently means without assistance. So now you can find the answer there. Eat. People who cannot eat is inability to eat. People who cannot eat means inability to eat. So this is how you can find the answer easily. First you have to go to the point. That's what I am teaching you. Skimming, scanning I am teaching you so that you can go to the answer without wasting your time everywhere. Next, question number 14. Question number 14. Patients whose blood oxygen levels are lower than dash may be at greater risk of dying. So that means you cannot discharge them. This is emergency case. So you cannot discharge them. So they are still, they should be under your care. So fireball 14. Okay. So patients should still be under your care. Yeah. A, B, C, D. So where will you find this information? Okay. Where will you find this information? Yeah. So fireball 14. Fireball 14. Yeah. Where will you find this information? A, B, C, D. Check which text A, B, C, D. Copy, post link. Yeah. Information. Check. Okay. Link I have given. Confirm. Confirm your answer there. Then next, you will go there to text. Okay. A. Then you will find out the answer there. So, blood pressure. Okay, that means oxygen, blood oxygen levels. Oxygen saturation, that is less than 90%. Less than 90%. So, less than is already there. Below is already there. So, just write 90%. Just write 90% because below is already there. Okay, it is in text A here. Here it is. Text A. Right. Next. So, question number 15. So, it is round 3. Yeah, we are going to round 3 now. Round 3. Print screen. Round 3. That is short answer questions. Round 3. Round 3. Short answer questions. Round 3. Short answer questions. Yeah. So now round 3. Okay. Fireball 15. So 6 more questions are there. Last 6 questions. Now before we move further, so provide for feedback regarding the second round. Provide your feedback. Is it helping you? Okay. Is this session helping you? How far it is helping you? Please provide the feedback. So one sentence, write your feedback in one sentence. And I'll give you my WhatsApp contact. so that you can message me personally so that I can give you these free sessions for the coming week. So contact the admin. Copy link. So all of you can just message me on this WhatsApp link. WhatsApp message so that I can send you the link every day. I'm going to give you three free sessions for the coming 3 days. Okay? If you are interested, you can get the link. Send a message to me on my WhatsApp. Right. Yeah. Next. So, how many mLs of fluid should be removed from the lung for investigation of the patient's condition? How many mLs of fluid should be removed from the lung for investigation of the patient's condition? How many mLs of fluid should be removed from the lung for investigation of the patient's condition? చెప్పండి. ప్రైజ్ నాన్న నేను క్లాస్లో ఉన్నాను, కొద్దిగా సేపు అయినాక చేస్తాను, ఆన్లైన్ ఉన్నాను, కొద్దిసేపు అయినాక చేస్తాను. ఓకే. Yeah. So now let us see which text you will find this information A, B, C, D. That you have to tell me first. So Fireball 15. Which text? Create poll. So will you find this information in A or B or C or D? This guessing is very crucial. If you can guess like this, it will be very easy for you. So logical reasoning approach. Logical reasoning approach. Yeah. So copy post link. Yeah. Regina Ofoso, don't send a direct message, send it to everyone, please. Okay. So because my message also is coming only to you. Now I have to change. So every time it is coming to you only. So everyone in the meeting. So Regina, send it to everyone in the meeting. Don't send to me particularly. No direct message, please. So next one. So go to C. Go to C. Yeah. So there you can see aspirate the fluid required here. Aspirate the fluid required for diagnostic analysis, generally 50 ml. So how much is required? 50 ml. This is normal. But for therapeutic use, that is different thing. For therapeutic use, that is something more, larger amount to be withdrawn for therapeutic reasons. So therapy reasons, larger amount. But it should not be, it should be limited to 1500 ml, not more than that. So otherwise, there will be this risk of pleural edema or hypotension. So maximum you can take only 1500. But this is not even, this is for therapeutic reasons. Normal reasons, diagnostic analysis reasons is only 50 ml. So 50 ml. So it should be how many ml? 50 ml of fluid should be removed from the lung for investigation. Investigation means diagnosis. Investigation means diagnosis, diagnostic analysis, or diagnosis, or analysis, or assessment, or evaluation, or examination. So that is Fireball 15. Then 16. Yeah. Last four questions. Last five questions. So, fireball 16. Yeah. Yes. So, this is fireball 16. Yes. Now you tell me which text it is. A, B, C, D. Will you find it in A or B or C or D? Okay. So this is 16. Yeah. 16. What do you think where you will find this information? Yeah. So when performing a thoracentesis, yeah, you have written C. Okay, good. So when performing a thoracentesis, which part of the rib should be avoided? Rib, which part should be avoided while inserting the needle? So go to C. Which part of the rib? Thoracentesis. Which part of the rib should be avoided? Which part of the rib should be avoided? So avoided. Question number 5. Question number 5. In order to avoid intercostal vessel injury, the needle must not touch. Okay, must not touch means avoid. What? Inferior surface. Inferior surface. Inferior surface. Okay, right. Inferior surface, not inferior surface. Right. So next, fireball 17. So check your answer there. Next, fireball 17. Yeah. Which treatment may be necessary? Okay. Which treatment may be necessary? Yes. For patients with ARDS. Which treatment may be necessary? Which treatment may be necessary for patients with ARDS? Which treatment may be necessary for patients with ARDS? Yeah. A, B, C, D. A, B, C, D. Yes. So question number 17. Yes. D. Okay. Check. Check whether your answer is right or not. Yes. So which treatment may be necessary? So you said it is D. So let us go to D. Yeah. ARDS. Which treatment? Treatment is here, right side. ARDS here, treatment here. So may require ventilation. So which treatment? Ventilation. So like that. Next, question number 18. 18. What should be used to protect the insertion site following a thoracentesis? So procedure A, B, C, and D. So logical reasoning approach. So, 18th one, text C, most probably. So what do you think is the answer? So that's it. Fireball 18. You can check it there. So what should be used to protect the insertion site following after a thoracentesis? So that will be in the last stage of the procedure. So we'll go to C, last stage C. So cover. So final cover, protection cover. Cover the site with an occlusive dressing. An occlusive dressing. This is the answer. An occlusive dressing. An occlusive dressing. Right. So next, 19. 19. Okay. 19. 19. What is the risk level of a patient with a curb 65 score of 2? Risk level. So is it in A, admissions, or B, recovery, or C, procedure, or D, complications? So tell me. So where you will find this information? 19th question. So question 19. This is for question 19. A. Check it out whether it is right or not. Curb score of 2. A. Go to A. So curb score of 2. So here it is there. So greater than 2, moderate risk. Moderate risk. One score 1, score 2, score 3 to 5. So 2 is moderate risk. So moderate. So it is moderate. Go to, yeah. What is the level? Risk level? Moderate. That's enough. Moderate. What is the risk level of patient with curve 65 score of 2? Moderate. So that's the answer. Next, going to 20th question, the last question. So, fireball 20. So, how is medication for bacteremia? Okay, usually administered. Bacteremia is a special complication. Okay, so bacteremia. So it will be in D. So go to D. Yeah, bacteremia is here. Bacteremia is here. So now you remember the question. Medication. Antibiotics means medication already given. Normally IV infusion. So IV infusion, intravenous infusion, intravenous infusion. So IV infusion is the right answer. So that is the end of the session. So last. So thanks for watching. Provide your feedback, please. Yeah. So thanks for watching. Provide your feedback, please, in 1 or 2 sentences. Yeah. So now let us see. I'll unmute all of you. Allow participants to unmute themselves. You can unmute. So first, Regina, share your experience. How was the experience?
I had a great time, and I've gotten a lot of information and strategy with this session. It was really a great session. I really like it. Thank you.
Yes, somebody was telling me that Regina has recommended me. Did you recommend recently anybody?
Yes, please. I recommended you to Dorcas.
Okay, okay. Fine, fine. Okay, she was asking me for admission, so I was asking you. Okay,
Oh,
so right,
oh,
thank you
okay.
for recommending. Then Abdul
Welcome.
Rahim, Simiat Abdul Rahim, Simiat. Simiat, can you share your experience? Simiat Abdul Rahim, Dorcas. Okay, fine. That's okay, no problem. So that is the end of the session. We'll meet again in the next session. Thank you for watching. Yeah, that is Dorcas. Yeah, Dorcas, you can speak.
Yes, yes, please. Thank you
Dorcas,
very much.
were
This
you
is
the one who was referred by Regina?
yes, please. I was the one.
Yesterday you were asking me, right?
Yes, please.
Okay, okay, no problem. I
Yes.
feel that you are very serious. Definitely, I'll support you, no problem. Okay, you can contact me later.
Okay, thank
So,
you
how
very
was
much.
the
This is the
session?
first time, but
How
I
was the
have really
session?
enjoyed it. Hello, please can you hear me?
Yeah, yeah, go ahead. How did you feel? What is your reaction regarding the session?
It's very educative, and this is the first time of me having a class with you, and I've really enjoyed this.
Yeah,
You really
no
took
problem.
your time here, so I was able to understand whatever you taught.
Yes. Okay. Thank you very much. Yeah, that's very nice. Simyat, welcome again. So you can all of you